Amlodipine. Amlodipine belong to calcium channel blockers class dihydropyridine, and often used to reduce systemic vascular resistance and arterial pressure. Amlodipine, sold under the brand name Norvasc among others. Medical uses of amlodipine. Amlodipine is used in the management of hypertension and coronary artery disease in people with either stable angina, where chest pain occurs mostly after physical or emotional stress, or vasospastic angina, where it occurs in cycles and without heart failure. Note: calcium channel blockers, including amlodipine, may provide greater protection against stroke than other classes of blood pressure-lowering medications. Amlodipine, along with other calcium channel blockers, are considered the first choice in the pharmacological management of Raynaud's phenomenon. Raynaud's phenomenon is a medical condition in which spasm of arteries cause episodes of reduced blood flow. Dosage of amlodipine. The defined daily dose is 5 mg by mouth. In adults, it is typically started at 5 mg by mouth once per day and may be increased to 10 mg once per day. Note: in older people or those with liver problems, it should be started at 2.5 mg once per day. Contraindications of amlodipine. The only absolute contraindication to amlodipine is an allergy to amlodipine or any other dihydropyridinase. In patients with cardiogenic shock, where the heart's ventricles are not able to pump enough blood, calcium channel blockers exacerbate the situation by preventing the flow of calcium ions into cardiac cells, which is required for the heart to pump. While used in patients with aortic stenosis, narrowing of the aorta where it meets the left ventricle, since it does not inhibit the ventricle's function, is generally safe, it can still cause collapse. Cases of severe stenosis. In unstable angina, excluding variant angina, amlodipine can cause a reflex increase in cardiac contractility, how hard the ventricles squeeze, and heart rate, which together increase the demand for oxygen by the heart itself. Patients with severe hypotension can have their low blood pressure exacerbated, and patients in heart failure can get pulmonary edema. Side effects of amlodipine: swelling, feeling tired, abdominal pain, nausea. Some common dose-dependent adverse effects of amlodipine include vasodilatory effects, peripheral edema, dizziness, palpitations, and flushing. Overdose of amlodipine management. Although rare, amlodipine overdose toxicity can result in widening of blood vessels, severe low blood pressure, and fast heart rate. Toxicity is generally managed with fluid replacement monitoring, ECG results, vital signs, respiratory system function, glucose levels, kidney function, electrolyte levels, and urine output. Vasopressors such as adrenaline are also administered when low blood pressure is not alleviated by fluid resuscitation. Thanks for watching. Please like, share, subscribe, and comments for any questions regarding amlodipine.